My name is Emmy Sanders. I am a lead productivity coach at Inspired Hygiene. Today I want to talk to you about April. It's Oral Cancer Awareness Month. Did you know that approximately 47,000 patients will die from oral cancer this year? That's 132 patients, 24 hours a day, 7 days a week, 365 days a year that will die from oral cancer. That's a lot. So let me share with you a quick story about a patient of mine, a 36-year-old male patient that I had been seeing every 3 months for periodontal maintenance. I remember he came in August and everything looked great. Then he came back 3 months later and something was different. After the doctor and I took a closer look and referred to an oral surgeon, he was then diagnosed with oropharyngeal squamous cell carcinoma. 9 months later, he is now in remission. So aren't I glad I looked? So I want to encourage you as a healthcare provider to have an oral cancer screening for every patient. If you're not currently doing that at every hygiene appointment, please find a way to incorporate that into your appointment. It typically takes 1 to 3 minutes and you could save a life. If you're already doing that and maybe you want to do something different for your community, you could reach out to your local CVS, Walgreens, Walmart, and see if you could go there and have an oral screening on a weekend. Complimentary, of course. You may get a new patient, but you also may save a life. And think about this. What if you allotted a certain amount of hours every month, maybe 3 hours, that you offered complimentary oral cancer screenings for walk-in patients into your practice? What if you had a simple oral cancer fact sheet displayed prominently in your practice, or better yet, you could send it home in a goodie bag with your patients, just to bring the awareness of oral cancer. Oral cancer is on the rise, and it's time to do something different. So I want you to write this down. OralCancerFoundation.org has some wonderful documents available for you to download. I've got some samples here for you to see. They have this great flyer if you decide to host an oral cancer screening event. So you just fill in your information. It's a wonderful flyer, great way to get a lot of people to come to your screening event. They also have oral cancer fact sheet. That's what I was talking about earlier, that you could print off and hand out to your patients or have readily available at your screening event. They also have a way for you to market your screening event. That's a wonderful tool. There are many other tools that are available at oralcancerfoundation.org, and you can also email me personally at me@inspiredhygiene.com, and I'll be glad to share all those documents with you as well. So let's review real quick some signs and symptoms of oral cancer. So we know that a sore or soreness that doesn't go away, red patches, white patches, pain, tenderness or numbness in the mouth and lips, lumps, thickening tissue, rough spots, crusty or eroded tissue. Those are all signs and symptoms of oral cancer, as well as any patient who has some difficulty in swallowing, speaking, or moving their tongue or mouth. Now, let's talk about who's at increased risk of oral cancer. So we know for sure that the heavy drinkers and our tobacco users are at increased risk. And remember, tobacco users, that can be the smokeless tobacco, that can be pipe, that can be cigarettes, and we're not really clear on how the vape market is going to end up on oral cancer, but I can't imagine that it's going to be a help. So also think about patients who have been diagnosed with human papillomavirus. That virus is actually what's causing a spike in oral cancer today in the United States. There's a link between oropharyngeal cancer and human papillomavirus. Now, think about gender Typically, men are 2 times more likely to have oral cancer than women. And age. Anyone over the age of 55 has an elevated risk of oral cancer. Now, the caveat to the age is the human papillomavirus patient, because they typically are a younger aged patient base. So age at 55 is not just 55, it can be a younger patient as well. And think about UV light exposure. So anyone who's outside in the sun for extended periods of time, like your lifeguard, your lawn care specialist, gardeners, anyone who's outside in the sunlight for extended periods of time. So, do you want to know more about oral cancer and April Oral Cancer Awareness Month? Please reach out to us at inspiredhygiene.com. You can email me personally at me@inspiredhygiene.com. I'll be glad to help you to get the materials you need to launch your own campaign to stamp out oral cancer. So the last thing I want to remind you of is early detection saves lives. Go out there, take a closer look, and stay inspired. Have a great month.